Welcome to the Titus Timeout podcast. I'm Matthew McLaurin. In this episode, we'll discuss the primary supply diffuser array within operating rooms. ASHRAE Standard 170 addresses the requirements for ventilation in healthcare facilities. Standard 170 requires these diffusers to be Group E non-aspirating diffusers like the TLF and TLFR. These diffusers have a unidirectional downward flow with minimum levels of entrainment. When used in operating rooms, the supply flow rate is limited by the average velocity, which must be between 25 and 35 CFM per square foot. The general premise is to create a column of clean air over the surgical table, surgeons, and support staff. As the only entrainment occurs around the perimeter of the diffuser array, the patient is effectively isolated from any pathogens that may be airborne in the room outside the sterile field. While it's important to isolate the patient from the air outside the sterile field, it is equally important to have as much coverage as possible directly over the patient and surgical staff as well. This is because both the surgical staff and patient are shedding particles into the space. The diffuser array shown here creates a boundary layer that separates the patient from the air outside the sterile field, but doesn't have coverage over the patient and surgical staff. As a result, the particles that are shed would rise into the air uncontrolled and could easily find their way into the surgical wound site or instrument table and result in the surgical site infection. The downward air motion from the non-aspirating diffusers controls the particles as effectively as possible, preventing their uncontrolled release and flushing them out of the sterile field. To ensure proper coverage, Standard 170 requires that the primary supply diffuser array have as much coverage as possible. It stipulates the coverage must be 12 inches beyond the table and limits non-diffuser space to a maximum of 30% of the supply diffuser array. An addendum to the 2013 edition of Standard 170 restricted this even further by defining the primary supply diffuser array as the area 12 inches beyond the table. This fixed the maximum area that could then be utilized for non-diffuser usage. Previously, this was variable with the size of the primary supply diffuser array. For more information on operating room design, visit our YouTube channel or e-learning site, titus-elearning.com, for access to a previous webinar on the topic of operating room design. Don't forget to subscribe to our YouTube channel while you're there, and thanks for taking the time out with us.